In this video, we are going to look at gastroenteritis. Modrik's is my name. Please make sure you share that link with your colleagues so that they can get all this information. It's always good when you find something amazing like this, you share with your medical colleagues so that they can also have something that they're going to improve their knowledge. Thank you so much. And here we go with gastroenteritis. These are the objectives that you are going to find or to answer in this video. We are going to define gastroenteritis, the causes, mode of spread, signs and symptoms, and how also can diagnose gastroenteritis. So, gastroenteritis is a medical condition characterized by inflammation of the gastrointestinal tract. Medical condition characterized by inflammation of the gastrointestinal tract. And when we talk about gastrointestinal tract, gastro stands for the stomach, entero stands for small intestine, and this results in diarrhea, vomiting, abdominal pain, and cramping. So there is inflammation of the stomach and the small intestine. When this happens, we call it gastroenteritis. Causes of gastroenteritis. The causes known, some of them are viruses. Example viruses that commonly cause gastroenteritis are rotavirus, norovirus, adenovirus, astrovirus, are known to cause viral gastroenteritis. So we have a type of gastroenteritis we call viral gastroenteritis, and these are the viruses that are likely to cause this. We are saying rotavirus is the most common cause of gastroenteritis in children. Note this, that rotavirus is the most common cause of gastroenteritis in children. And remember, this also causes diarrhea. Then norovirus is the leading cause of gastroenteritis among adults. These are points to note. Then next, you're going to look at the bacteria. And remember now, this one causes bacterial gastroenteritis. So we are looking at examples of bacteria that can cause gastroenteritis. Here we have Campylobacter jejuni is the primary cause of bacterial gastroenteritis. So in addition to Campylobacter jejuni, we have Escherichia coli, Salmonella, then there is Shigella. And we are saying Salmonella is contracted by ingesting the bacteria in contaminated food or water, or by handling poultry. Still talking about Campylobacter, we are saying it occurs by consumption of raw or uncooked poultry meat and other foods. It is also associated with unpasteurized milk or contaminated water. So when we talk about this bacterial gastroenteritis, we look at even the Clostridium difficile, and we are saying it's the most important cause of diarrhea that occurs more often in elderly. Then we talk about also the Staphylococcus aureus, and you are saying infectious disease. Infectious diarrhea may also occur in those who have used antibiotics. So that is the second cause of gastroenteritis, which is a bacteria. The third cause of gastroenteritis, they are parasites. And they are saying a number of protozoa can cause gastroenteritis. And example of these parasites that commonly cause gastroenteritis, we have Giardia lamblia, then we have Entamoeba histolytica, and lastly, Cryptosporidium. These are the three common parasites that cause gastroenteritis. Then we have also non-infectious causes or other causes of gastroenteritis other than the virus, bacteria, and parasites. We have medicine or medications like non-steroidal anti-inflammatory drugs. We have certain foods such as lactose, especially those who have intolerance. Then we have Crohn's disease, and that is inflammatory bowel disease. So those are some of the causes of gastroenteritis. How is it transmitted? We are saying that the germs are spread through feces or vomitus of someone suffering from the infection. Remember the 4 F's. When this feces or vomitus is ingested through any way, either by drinking untreated or unboiled water from the rivers, eating cold food, or not washing hands, you are likely to eat these feces or vomitus of someone who are suffering gastroenteritis, and eventually you are going to get it. So it is something to deal with the hygiene. We are saying eating unwashed fruits or vegetables, serving foods and drinks in dirty containers, keeping drinking water in dirty containers, poor disposal of feces, poor rubbish in a compound, open rubbish in the compounds which attract flies and cockroaches. They are likely to bring these feces and vomitus of an infected person, and once you ingest them, then you are likely to suffer gastroenteritis. Something to note: a person with gastroenteritis is most infectious from when their symptoms start until 48 hours after the symptoms have passed. So this is a highly infectious disease. Imagine someone's symptoms have ceased but is still infectious, although they may also be infectious for a short time before and after this. Signs and symptoms of gastroenteritis. The common one is diarrhea, that is passage of watery stool 3 or more times a day. There is vomiting. Blood or mucus can appear in stool, which you call melena. Crampy pain in the abdomen, low-grade fever. There is headache and aching of limbs. Those are some of the signs and symptoms. In addition to that, people also have the signs of dehydration, and some of these signs of dehydration, which also can appear in this person of gastroenteritis, to have muscular cramps, sunken eyes, passing little urine, which you call oliguria. There is a dry mouth and tongue, weakness, irritable, tiredness, dizziness or lightheadedness, headache, weakness, confusion, rapid heart rate, coma, even producing little urine. How do we diagnose this condition? Gastroenteritis is diagnosed clinically based on a person's signs and symptoms. In addition to the signs and symptoms, we do stool cultures so that you can identify the microorganism. Thank you for listening. Please make sure you share the video with your colleague so that you can get all this information. God bless you. Modrix is my name. Share the link with a colleague.